Thank you very much, and thank you for inviting me to South America. This is the first time I'm come here. It's a beautiful place, and so far I enjoyed the hospitality from Canon as well. Thank you. And so I will try to take some of the myths of the artificial intelligence as well. I know we had a lot of discussion about artificial intelligence taking over our own ability to perform procedures, but the Canon artificial intelligence is all done in the factory. The artificial intelligence does not interfere with you in the cath lab. All the learning is actually in the factory, and then it's like a software upgrade that is put back into your cath lab, and the learning it's actually used to perform the procedures in the cath lab, but there is no artificial intelligence in the cath lab. So nothing is going to suddenly happen and say, stop, you can't do this, and no voice is going to take your hand off. You are the one who is going to perform the procedure. All the learning is done actually in the factory itself. We'll go through a few things. Some of my conflicts. So I am a cardiologist who come from New Zealand. We catch about over 1 million population in the hospital that I work. We have 4 cath labs. We do about 5,000 plus procedures in our lab. We do interventional, structural, and electrophysiological procedures. And I'm fortunate to have trial the Canon's artificial intelligence tools, and we were a trial site for them to learn and go through the procedures. So the current cath lab actually demands the image quality to improve, to minimize radiation. So one way you want better image, the other way we want less radiation, which is usually conflict with each other. And it wants us to shorten procedure processing time, improve the decision making, and improve the workflow. Now, all of these things that I have listed here is answered by the alpha-evolve technology. So the technology consists of 3 things. It's the alpha-evolve imaging, the dynamic device stabilizer, and the echo fusion. All of these 3 that makes the alpha-evolve technology that comes into your new cath lab when you purchase as an addition. So there are 3 images that I put up here, okay? So one is a fluoro, one is an artificial intelligence derived fluoro, the other one is a diagnostic angiogram or a digital angiogram that is obtained. Now, which one is which on this image? I'm going to show the fluoro because that's very easy to understand. It's a little bit mottled. Who thinks the second image is a digital acquisition? Hands up. Okay. Who thinks the second one is a fluoro from an artificial intelligence? All right. In fact, the second one is the digital acquisition, and the third one is the artificial intelligence. And that is a fluoro. In fact, it is 5 times less radiation, and it's very hard to pick. The images are very good. So how does this work? So you see in this image. So it's very important. There are 2 phases for this image. The first phase is the learning phase. The learning phase is not done in the cath lab. It is done in the Canon factory itself. So all the learning is done there. It picks up many fluoroscopic images that we actually provide to them. It picks up many acquisition images, and it learns from that. And then once it learns from that, now you get something like a software upgrade. There is no artificial intelligence in your lab. It is the imaging that is learned from the intelligence that is put back as a software upgrade. So from that, as soon as it recognizes a fluoroscope, it will immediately work out, these are the things I need to do it to enhance the image. That is what happens in the lab. And it will immediately change it that looks like a diagnostic angiogram or digital angiogram. So while it does that, so the main aim here is to increase the contrast to noise ratio, because that is what we see with the fluoroscopic image. So you see a lot of mottled image in the fluoroscope. That mottling is taken out. So you would see the next image as a slight blurring of the background. And so by doing that, it enhances the contrast, so you see the vessel much clearer. So that is increasing the contrast to noise ratio, and that is the part that is done by the artificial intelligence from what has learned in the background from the factory. So here you can see a stent. Now the first one is a fluoro. It's a create stent, so you should be able to see the 2 ends of the stent. But on the fluoroscope, when we try to post dilate, sometimes it's still very difficult. compared to the next image, this is just a fluoro, haven't done any stabilization of the stent, just putting your leg on the fluoroscope. The artificial intelligence image, you can see the stent is much better demarcated for the no extra penalty, no extra radiation, but better image quality. So that is pretty much what you get from the alpha imaging. So how does the workflow happen? This is not complex. So you have a little keypad in front of you. That AI 1, 2, 3, 4 is left to you. Maybe eventually you won't have all 4 options. You will just have one button to say AI, or you take it off. So what the 1, 2, 3, 4 does is 1 has a little bit of AI, 2 has a little bit more AI, and 4 pretty much has a lot of AI input in it. You can decide what your eyes want to see, and if you like a lot of AI, you can press 4. You want less AI, you can press 2, and it'll immediately change the images according to what you want. And then when you do the imaging, so the first pedal is your normal fluoroscopic pedal. The second pedal is your digital acquisition pedal. The third pedal is a fluoro record, so you don't need to press anything. So you want to use the artificial intelligence, you just press the third pedal and do a contrast injection, and it'll automatically save it and play the images for you. So the workflow is not interrupted by using this thing. You just press the button, press the pedal, you are running with artificial intelligence in your cath lab. So this is, again, one showing the red one is actually the digital acquisition. The right one is actually showing the fluoroscopic acquisition from the artificial intelligence. No difference in the pictures, but you have 5 times less radiation. This is very important for the people who work in the cath lab. The patient only gets exposed to radiation once. We get exposed to radiation throughout our life. And interventional doctors are known to have 20% more cancers on this side of your body because of constant exposure to radiation. So anything that you can reduce in the cath lab makes a big difference for the rest of your life. The radiation is not hot, but it'll get to you eventually in your life. So this is why the reduction in radiation becomes very important. So this is another angioplasty using an αEvolve imaging technique for the whole procedure. No DI used for this whole procedure at all. So this is like a subtotal occlusion of the LAD. You can cross the lesion, you can balloon the lesion. Again, when you are placing the stent, you can see the side branches on this image, so you are not losing the side branches. You can still see them and place the stent where you want. Now, when the stent expansion, you can actually see where the stent is not properly expanded in different spots, and then you can eventually expand that and you can get your final results, what happens to the vessel. This is another vessel with aneurysmal proximal LAD that we are trying to cross with the wire. You can still see the calcium demarcation on the artificial intelligence here on the evolve imaging, and then that helps you to cross the lesion. The next one is a different Canon tool called the Spot ROI. Now, Spot ROI is not an artificial intelligence. It is literally a collimation that is done, which is slightly less, so you can actually see the equipments on both sides of the collimation. By just doing this, you will 80% reduce your radiation that you will need, while you see the rest of the image, and you will focus on the center, which still does not alter the image. But with this, using the αEvolve imaging, you actually even get much better imaging when you use them. So even for Spot ROI, this system works very well. That is the αEvolve imaging of the artificial intelligence. The next component of it is once you have got better image, you want to see the stent. How well are you going to see the stents? Now, we are all used to, I think a lot of people have Philips lab in this country, so the word stent boost is very common. But the same stent boost in Siemens lab is called clear stent. In the Canon lab, it's called stent enhancer. They give you the same thing. They are very, very clear image. But what are the downside? You get extra radiation because you are acquiring that image. The images are static. So by the time the images is static, it is different to the heart that is moving. Your balloon might have moved from the spot that you were keeping your balloon at. And then there's disruption to the workflow because it needs to be processed. So you do an acquisition. It takes about 10 seconds to process to get the stent boost back on the screen. By that time, sometimes your balloon's not on the place and you've got a fair bit of radiation. To overcome that, you have live stent boost system. So in the Philips system, it used to be called the Sync Vision, which is a third party, which is now getting integrated with Philips, but it was originally a third party. Now, with Canon, the DDS system is something that belongs to Canon, and Canon has worked through this to incorporate this into the αEvolve technology. What is DDS? DDS is Dynamic Device Stabilizer. So Dynamic Device Stabilizer, what it does, it can be used for fluoroscope, It also can be used for digital acquisition. You just will get much better imaging. What it does is it works only on these 2 dots of the balloon. So the imaging has been constantly taught to learn the 2 dots of the balloon. As soon as you see anything two-bot, it can be a balloon or a stent, it will stabilize. See, the heart is moving in the background, but the stent doesn't move. So that is what it does. So immediately will stabilize the 2 dots and will enhance the image and make it a little bit magnified for you as well. All of this happens by just pressing the pedal with no post-processing time. It literally happens within the second for you to run your lab. Now, do you want to use it or not is your choice. There are 2 screens here. One screen is your fluoroscopy screen. The second one will be your DDS screen. It'll run in parallel. You don't want to look at it, you can carry on the way you normally do your case. But if you want to, you can look at it and enhance the procedure as you go through. So how is that done? Again, all of the learning is done in the factory. There is no AI in the cath lab. This AI has been shown 2 dots, 2 dots, 2 dots of balloon multiple times from stents and the balloon. And so if you have like a 1.5 balloon, it won't work because it only has 1 dot. So you need to have 2 dots, and that is how it learns. And as soon as it sees the 2 dots in your cath lab, their neural processing works and will immediately stabilize the 2 dots, enhance it, so no movement, but the heart will move in the background and will give you a much better picture. So let's see some examples where you use the device stabilizer. The workflow for this is very easy. So I have, you know these presets buttons that comes in any cath lab. One of this button is called D. So I just press D when I want to use it, and immediately your screen flow can change to the way you want it. So I usually have 2 images, my live screen, my multiple reference screen, hemo screen, IVA screen, OCT screens. All of that can come off the screen. Okay, you just have 2 screens you want. So you have your DDS screen and your other screen that is your live fluoro. If you want your reference screen, they can stay on. And you press the button off, you just go back to your old way you work with. So it's just a press of a button and come and press the button again. So that is the workflow. When do you use them? You can use them to position a stent, because if there is a previous stent in there, see, this stent has immediately come in to stop. So as soon as the DDS is done, the 2 dots won't move very much. So you can you see the other stent also very closely, so you can actually position a stent. When you inflate, it can tell you how much the stent is expanded, but more so, you are getting a view that looks almost like a stent boost with no extra radiation and no processing time. That is the main advantage of this system. So these are some comparison image. The first 2 is fluoroscope. So fluoroscope, 1/5 of radiation. This is what you see in the fluoro in your lab that you are currently working with. This is what I see with the DDS on the fluoroscope. Same fluoro, same patient, same time, done. I've just taken 2 pictures done from the 2 screen and just put it next to each other. This is what we currently work with. This is what you will be working with if you use DDS. Now, if you don't like this and you want a bit more imaging, you can do an acquisition, 5 times radiation. Every time you press that pedal, remember, it's 5 times radiation. Yes, your fluoroscope will look much better because you have acquired it, but in the DDS screen, it will look even better. Now, if that is not enough for you, you can wait for 10 seconds and do a post-processing, and you'll get an image that looks like a stent boost image, which is just an enhancer image in the Canon lab, which is even clearer. But for most patients, you don't need this when you're trying to inflate a balloon. So this is just an example, a patient who's coming with an MI. This is how my screen looks like when I press the DDS button. I have a reference screen, a hemo screen, my live screen, and the DDS screen coming on the end. And pretty much immediately sees these 2 dots, stabilizes everything around this area, but this is what you are currently working with. This is what you see in your screen in the lab. This is what you get when you have DDS. It will immediately stabilize it, enhance the image, and then once you deploy the stent, when you do post-dilatation, again, this is what you currently work with, but this is what you will be working with. There is no delay, there is no extra radiation. You just keep going in the cath lab, and you will actually increase your workflow much better. So that is the DDS system. The last system is the echofusion. Echofusion is mostly used for structural heart disease. Now, echofusion is something that Philips had something called the Echo Navigator for a long time. If people who have used Philips lab will be familiar with it. Siemens have TrueFusion, and Canon has the echofusion. In fact, the Philips one obviously has a 2D and 3D live fusion in there. Siemens, who had this technology for a while, still does not fuse the image. Only the TrueFusion 2 now is coming with image. With the previous Siemens system, you can only put a dot, and the dot will come up on the fluoroscope. You cannot see the image. Now, Canon comes into the market directly with bringing the image into the cath lab, and you will actually see the image on the screen at the same time. And because this is AI intelligent process, so people who are used to Philips, which I have now had Philips Echo Navigator for 10, 15 years in my cath lab, you know you need to zero the bed, you need to go and do orthogonal planes, and the bed height can't change through the procedure, then you will carry on with your echo fusion. Now, if you change your bed, you need to go back and zero. Now, that is changing with the new Philips technology, but that is how it used to be. With this being an artificial intelligence, it actually looks at the probe and will constantly chase the probe, so you don't need to worry where your bed is. It will actually find you and it will give you the image. That is the advantage of the AI technology. So here is a balloon mitral valvuloplasty. You can see the echo. Now you see the soft tissue is come on to the radiation. So you see that in your live screen. It makes it much easier. Your workflow is much easier when you see the image to do this. The current systems does not tell you where to put the screen. Okay, so it's pretty much what you're doing here is, if you're doing a 2-chamber view, you need to go on to a RAO view. If you're doing a 3-chamber view, you need to do RAO caudal. If you're doing a 4-chamber view, you need to go to an LAO cranial. Now, in the ideal world, what it should do is the echo and the cath lab should talk to each other, so the II and the echo will move together, but this doesn't happen that way. So I'll show you some quick examples here. So what happens here? Again, all of this is learned in the Canon factory, not in your cath lab. Multiple TOE probes have been put. This is a Canon probe, so to use this technology, you need to have the Canon echo machine, and it will learn multiple times the probe, and then immediately when it sees the probe in the cath lab, it knows what image is coming out of the probe, and it will fuse the image onto your live fluoro. So that's pretty much how the echo fusion happens in the lab. This is just showing your workflow. So I have my echo image here, my live fluoro here, and then I have the fused image here. You have some hemo, so you pretty much will see where the image flows. For people who don't do structural work, this is SVC, IVC, and the image is here, so it's fused, and this is a PA shot. So the PA shot should correspond to a PA view of the echo, so which is about 90 degrees, so it will fuse and give you the right image. If you go into a different view, it will go into the screen. So this is a PF4. You can see the PF4 crossing. It makes it much easier, because this is kind of how we cross. When you have the image on the fluoro, it's just much easier to cross the PF4, and then pretty much people who balloon size can balloon size, and then eventually you're deploying the device, and then the device also pretty much comes up here. Whatever that shows up on the echo will show up here on the fluoroscope as well. This is again another PF4. Sorry, this is another ASD. Oh, sorry, that went back. Anyway, it's not playing. Let's go on to the next one. So it's another ASD. It shows how, this is a ASD, just shows you how to cross the ASD. I'll just go on to the next one. This is a slightly complex ASD, because this ASD is not what the patient was born with. This is an EP procedure. They tore the septum during the EP procedure. So the ASD is in a very unusual position. Now, this is something that you do not want to do in your cath lab. If they're going to do a biplane and you're trying to fuse, two planes are coming up here. One plane is going into the screen, one plane is on the screen like this. So that means you will be very confused. So if you want to use biplane, then you can use these dots. So these two dots are put in two orthogonal planes. When they come together, you can just cross through that dot, because you know that is where the hole is. So that is the only usual. Otherwise, usually the single plane is much better when you do echo fusion in the cath lab. Again, this is just showing you the principle I told you. If you show the valve like a circle, that circle is inside the screen. That is why the fusion is going into the screen. So no point doing it like that. As soon as you do a biplane of that circle, now the valve is in a longitudinal view, and you can see that is fusing. So it's very important, if you want to fuse the fusing image and the the cath lab II should be in the same plane, so that images are fused together. So this is just, I'm going to finish off with a patient with that severe MS that I showed you. You want to do a transeptal puncture. Again, you want to do a very specific puncture in the mid-posterior segment. You can see all of that fused on the image, so you know exactly where your catheter is correlating to. And then you can use the biplane here, and you can actually decide you want to go posterior, and then you can do the puncture from there. And you saw the balloon mitral valvuloplasty that I showed you before, so I will move from here. So just to summarize, so αEvolve technology comprises of three things: αEvolve imaging, enhances visualization and reduces or removes the need for DA in some of the procedures that you do. The DDS provides faster results with no dose penalty because you don't need to do anything. It's all fluoroscope to enhance the stents and balloons for coronary intervention. The echo fusion improves the workflow and aids clinical decision making. Now these technologies continue to grow, and as they grow, the wider clinical implication of this technology will continue to develop. Thank you.